Good morning, colleagues, and welcome to the 2025 Delaware Healthcare Workforce Summit. As you look around the audience, you will see healthcare, dental, and public health professionals, human resources leaders, policymakers, and elected and appointed officials. You might be asking, what is Delaware Health Force? A public-private partnership, Delaware Health Force is a program of the Delaware Academy of Medicine. It is operated in close collaboration with the Governor's Office, Delaware Healthcare Commission, Division of Public Health Office of Healthcare Provider Resources and State Office of Rural Health, and many other institutions and nonprofits who share common goals and vision: the wellness of all Delawareans and the healthcare workforce who cares for them. Last year, our opening keynote, delivered by Dr. Michelle Washko, Director of the National Center for Health Workforce Analysis, provided a national perspective from the Health Resources and Services Administration. We discussed expanding educational and advanced clinical opportunities to address our workforce renewal and shortages with a panel of experts from across the state, and heard from representatives from Dover, the Medical Society of Delaware, and Lored Health Center, highlighting critical areas of need and solutions on advancing care through workforce development, implementation, and innovation. Our memorable lunch keynote speaker, Dr. Bernadette Melnick, addressed provider well-being and battling burnout, while our afternoon panel, led by the Delaware Healthcare Association, took a deep dive into the complex institutional challenges and real-world solutions faced by Delaware institutions. We concluded the summit with a presentation from the Milbank Memorial Fund on maintaining momentum. And indeed, we have done just that. Our Delaware Mini Medical School program has engaged nearly 5,000 Delaware students in grades 5 through 12, as well as undergraduate and graduate education, and adults thinking about a career change, encouraging them to pursue a career in the healthcare sciences. This year, we are pleased to count a number of those students in the audience, mapping their own futures in the health sciences. Some of these core students expressed interest in learning more hands-on skills, and thus we created the Delaware Youth Medical Academy, an offshoot of Mini Medical School which partners with institutions across the state to provide these students access to skills like CPR, intubation, casting, and suturing, skills they likely wouldn't see until medical school. Our student financial aid program has provided loans to 31 Delawareans pursuing healthcare degrees, including nursing, physical therapy, dental hygiene, medical assistance, and other clinical fields. We need to leverage our collective resources to drive significant change. With matching funds from ChristianaCare, we provided the Community Health Workers Association of Delaware with needed funding to move forward with the certification of CHWs, a critical component of the combined public health and clinical health workforce. In collaboration with the Sussex County Health Coalition, we have expanded our reach and understanding of our southern counties. We have conducted several successful sessions of Mini Medical School, focusing on students, providers, and opportunities in Kent and Sussex, and expanded the training and apprenticeship programs for community health workers south of the canal. In partnership with state legislators and with support of the Office of Healthcare Provider Resources, the Workforce Subcommittee of the Delaware Healthcare Commission, and many others, we saw the passage of Senate Bill 122, a critical step in collecting much-needed workforce data as a part of licensure and relicensure. This data will lead to better decision-making, and Delaware Health Force is prepared to lead the way in data analysis for the state and for our institutional partners. We are honored to work closely with the Division of Professional Regulation, Agile Cloud Consulting, First Ascent, Momentum, and Tech Impact, and in achieving this goal, creating increasingly sophisticated and accurate mapping and analytics tools to help answer important questions in relation to the healthcare workforce in the first state. In the past year, we have provided an editorial statement on the Diamond State Hospital Cost Review Board, offering our understanding of workforce data for their consideration. In another editorial, we emphasized the critical importance of all our healthcare institutions, hospitals, and federally qualified health centers in addressing access needs throughout the state by meeting people where they are, in the physical world, or by utilizing telehealth and mobile services. This year's conference will delve deeper into key areas. First, we will hear about the potential ways we can inform policy, align initiatives, and advance health, based on the success of the Bowen Center for Health Workforce Research and Policy at Indiana University. Next, we will examine the relationship between early to post-secondary education and the future workforce, as well as overall health literacy and health outcomes in Delaware, as presented by the Rodell Foundation, a thought leader in education in Delaware. We will hear from federal and state elected officials on recently passed legislation, as well as upcoming legislative initiatives with which they are involved. At lunch, we will hear from the cabinet secretaries from the state of Delaware Departments of Health and Social Services, Education, Insurance, and Labor. We will devote a session today to the vital importance of primary dental care and reaching the public where they are, and highlighting initiatives of the state's Dental Society and Delaware Institute for Dental Education and Research program. In the afternoon, we will release preliminary results from a major research project that utilizes data from the Delaware Health Information Network to identify Delaware's top 30 chronic diseases and compare them against workforce data from across the state for our insured population. Finally, to wrap up this year's conference, we will hear from the director of the Delaware Division of Medicaid and Medical Assistance. We act on data, which will help to inform future policy and legislative activities. We educate the future workforce with experts from institutions throughout Delaware, provide loan funds to our future healthcare provider workforce, and listen to you and our stakeholders on how we can improve the health of all Delawareans together. At this time, please welcome Delaware Health Force Director Tim Gibbs, along with Nicole Moxley, Chief, Office of Healthcare Provider Resources, and Director of the State Office of Rural Health, for opening remarks.